If you haven't already, it's very likely that every one of you watching this video in the next 12 months is going to catch COVID-19. This video is an action plan on how to minimize the effects of COVID-19 on your body. I'm Dr. Michael Alter, President of Alter Health Services, your healthcare detectives. In this video, we're going to talk about why so many people are being impacted by this virus. We're also going to be going over the new information on how this virus replicates, and even better, how to limit that replication so your body can get ahead of it. And finally, we're going to discuss those substances that you need to get right now to protect yourself. Let's get into it. Why are so many people being affected by this virus? The simple answer is because it's never been seen before. Our bodies have no defense against this. That's why it's called the novel coronavirus, the new virus. This virus packs a punch because it is 2 to 3 times more contagious than the flu. The issue with this novel coronavirus is that it's new to our immune systems. The human body has not seen this before, and it's unprepared for the attack. This virus hijacks our cells and uses them to create greater numbers of viruses. Later, we're going to cover how we can turn that fact against the virus to help destroy it. Because just one infected cell can produce millions of virus particles. We know that this virus attaches to the cell like a lock and key, involving something called the ACE2 receptor site. We'll call this the lock. It's important to understand this if we're going to limit the effects of the exposure. Understanding the ACE2 receptor site is involved because we want to do those things that make that less receptive to the virus. Limiting the effects of the virus does involve limiting our exposure. So it's important to understand there are really 2 aspects of this. One, we want to do all the things that we've been taught to do as far as social distancing and washing our hands and not touching your face. And you need to do those things. Those are important. But we also want to decrease the virus's ability to attach onto our cells if we are exposed. So going back to the ACE2 receptor site, traditionally, it's often told to people to fight viruses to megadose vitamin A and vitamin D. Well, the problem with that advice in this situation is that vitamin A and vitamin D have an upregulatory effect on those receptor sites, making them more active, making them more receptive in the sense to the virus particles. We don't want to roll out the welcome mat to this thing. So taking megadoses of vitamin A and vitamin D in this case may not be the best idea. Now, I'm not suggesting that you stop taking vitamin A and vitamin D. You should still have them in the quantities that are needed for good nutrition, but you may not want to overdo them. Limiting this virus's ability to reproduce itself is absolutely critical. In essence, it's like flattening the curve internally. We know our society is trying to flatten the curve by keeping the number of people initially sick from this virus to be as low as possible to not overwhelm our healthcare system. Well, we want to do the same thing inside our bodies. So if we can lower the virus's ability to replicate itself, then we lower the amount of virus particles that can infect our bodies, and we can flatten the curve that way. We know that this virus, once it gets inside the cell, needs something called the PLA2 enzyme to stimulate its own replication. Like I had said earlier, it hijacks the cell and makes the cell reproduce more virus particles. But it needs this PLA2 enzyme to make that happen. So if we can suppress that PLA2 enzyme, we can decrease the amount of virus replication and keep the numbers low, which would decrease the amount of symptoms you would get and the severity of the illness overall. It also should shorten up the recovery time quite a bit. Currently, there are vaccine trials underway, but no vaccine yet. And they are trying to repurpose older medications to help combat the virus when necessary. But those things are in short supply and really only being used when people get to a certain level of illness. We want you to be empowered with the latest and greatest knowledge that we can give you. And we want you to have the substances available for you to start taking right away. But also, again, at some point in the next several months, you're very likely going to be exposed to this. So you want to have this stuff on hand so that you can at any point start to decrease the amount of replication that this virus does inside your body. So hopefully your symptoms are extremely mild. I have spent many hours researching this, talking to colleagues that are both immunologists and virologists from all over the world, quite literally, trying to get the best information to present to you right now. I put together both that primary ingredient that you need to decrease the replication of this virus and companion products that are clinically proven to be strongly antiviral that will support your immune system to produce antibodies to tag and bag this infection. Plus, as a bonus, ways to supercharge this whole virus rescue protocol. Click the appropriate link below to get the information that you need right now. I want you to be empowered with the latest and greatest information that I can present to you. So please subscribe to this channel and hit that notification bell so you know when the next video comes out. Share this information with others as we go through these very difficult times. From all of us at Alter Health Services, I'm Dr. Michael Alter, your healthcare detective, wishing you good health.